Good evening, members. I hope everyone is okay and you can get my audio. Using the emoji reaction, kindly confirm you can get my voice. Yeah, perfect. Thank you. Thank you so much. Welcome to the session. Maybe for the next 3 or so minutes, just introduce yourself in the chat box, your name and the county you're listening or joining in from, as we allow our colleagues who are yet to join to also join. And again, just as a reminder, feel free to share the link with your colleagues, your mates, reminding them that we are starting in a few. We do not want to leave anyone behind. Yeah, welcome all. I think we are getting the numbers in. Again, just a few minutes to allow everyone to join in and then we begin. But even before then, I just want to formally welcome everyone to this session, which is part of the pre-conference webinar series for the 46th PSK Annual Scientific Conference. And tonight, we'll be tackling a very important topic on transforming access, a conversation on how community pharmacies are at the center of securing Kenya's family planning future. And very pleased to have experienced speakers as well as a moderator that I will introduce in a few. We will be doing this for the next few weeks as well, just ahead of the conference. And just as a reminder, maybe as a highlight as well, is that In Supply Health has supported this session, and they will be one of our sponsors for the PSK conference, uh, in particular for a panel session. More will be shared during the session, and we hope that you will join us in Mombasa so that we interact and you get to be part of the conversation. Just to show how the session would look like, in a nutshell, we will have a few remarks from Dr. Sheila, after which we'll have presentations from Dr. Irene and Mr. James. Afterwards, we'll have the opportunity to engage them in a Q&A, and hopefully you'll still be around for a few exciting announcements that we have to share with you. And I'm glad that you are all with us. My name is Dr. Silvanas Manyala. I serve as the PSK Communications Associate, and for purposes of this session is just to invite you and welcome you to this webinar. As background again, as a reminder, is that we have the conference happening next month. Okay, it's actually this month. Happy New Month, everyone. Between the 24th and 26th of June at Pride Inn Paradise Hotel in Mombasa. Yeah, I have to catch up with the timeline, and the theme is around pharmacists leading transformation and innovation towards the highest attainable standards of health. InSupply being one of our innovation partners. We are glad to have them participate in this conference, advancing UHC and, of course, sustainable healthcare access and delivery. I want to take the opportunity to invite Dr. Sheila to take over the moderation. And, of course, I will still be the background to support in case the challenges. But at this juncture, allow me to hand over to Dr. Sheila. You have the floor.
Thank you so much, Manyala, for the introduction. And good evening, everyone. Karibuni sana to our webinar today. It's a pleasure to meet everyone. We are looking forward to a very interactive session with you. And we hope at the end of the webinar, a lot of learning will take place. Please ask as many questions as you can and share as much feedback as you can also through the chat. Engage with us through the Q&A so that we can be able to just get a glimpse of what you are thinking about as the sessions proceed, as the presenters continue to present. A brief introduction. My name is Dr. Sheila Wageshi. I am a pharmacist by profession, but I currently work at InSupply as an analyst under the market access and shipping domain, where two of our transformative project seats that are focused on community pharmacy access for family planning services. And we'll be highlighting a lot of the work that we do, also collaboratively with PSK as an association, since the membership sits at the association level. And we hope that throughout the journey for today's evening, you'll be able to at least pick one or two things that you can take back with you throughout the session. I'll go dive in to just a few housekeeping rules. So your participants will remain muted throughout the session, just to allow speakers to have a chance to share what they have with you. And also, please use the Q&A tab at the bottom of your window to ask questions to the presenters, and they'll be able to tackle them at the end of the presentation. Also, just a kind reminder that the session is live in the PPB portal. So please subscribe so that you can be able to get CPDs at the end of the session. And also the session is also being recorded. So for those who may miss something or for those who would want to follow up on something, you'll be able to access the recordings both on InSupply Health's YouTube page and also the association's YouTube page. So again, just to go through what we shall be covering today in our agenda. So you'll be able to just appreciate who we are as InSupply Health and why the work we do matters. We'll also go through the landscape, so mapping the pharmacy journey that we've been able to walk in the projects. You'll also be able to appreciate how we've done onboarding and also just appreciate how the safe model in a community pharmacy that's providing family planning actually is structured. Then we'll share a few key highlights or key insights that we've been able to gather throughout the implementation. And then we'll have a Q&A session and a few conference updates on how you can engage with us further and a few next steps at the end of the session. So I want to take this opportunity to welcome our first speaker, Mr. James Kamande, who is the Regional Manager for the Market Access and Shipping domain within InSupply, and he'll be taking us through the first session. Karibu sana, James.
Thank you so much, Dr. Sheila, and also Dr. Manyala for the introduction. So to our listeners, my name is James Kamande. I work with InSupply Health. Professionally, I'm a public health professional with 18 years experience in health marketing and shipping. And I'll start by just taking you through who is In Supply Health. So In Supply Health is an East African health advisory firm that pioneers innovative approaches for health access and outcomes through strengthening health system and supply chain. And we purpose to enable communities to lead full, healthy, and happy lives. Our mission is transforming health outcomes by co-creating intelligent and resilient people-centered supply chain with a vision of being the leader in supply chain advisory and expanding access in Africa. We have established offices in Kenya and Tanzania, and we are hoping to establish more offices in Ethiopia and Uganda soon. But we also offer technical assistance across many countries within Central and West Africa. Next, Sheila. What do we do? So we have 4 main areas of domain expertise. Our first area of expertise is supply chain transformation. The second one is market access and shaping, data transformation, intelligence and impact, and also workforce optimization. How we do this? We aim to transform access and supply chain system performance from the inside through scalable and sustainable innovations or innovative approaches. And we aim to address the priority of our clients through co-creation. We majorly use catalytic implementation model and adaptive learning model to achieve or to drive our solutions. And we package the innovative solutions that I've talked about into core and context components that can then be adapted across context and scaled by others, including MOH and Profas. Next. Maybe I can take a moment just to take you sometimes back or to give you the background. Firstly, in our F2 2030 that I'm sure many of you are aware, Kenya targets to increase modern contraceptive prevalence rate for married women from current 58% to 64% by the year 2030. And we are just 4 years to the year 2030. So you can be asking yourself whether we are achieving that dream. To achieve this, the health system must remain innovative in how and where services are delivered. However, we still have some challenges that we experience in the country, and some of them have been addressed to some extent, and others are still being felt. This includes access to underserved population, including youth, unmarried women, and people in peri-urban or remote areas. Other barriers include stigma to access of family planning and contraceptives, the need to travel for long distances to seek for health services, including family planning, the long waits that people have to wait at the waiting bay. Sometimes we also, our client experience provider bias for many reasons, frequent stockouts, and especially at the last miles. And what will be the role of community pharmacy in addressing these challenges and barriers? Firstly, there are some strengths that have been identified within the community pharmacy, including community pharmacies are widely distributed across the country. They are flexible in terms of operating hours, and the clients perceive them as non-judgmental and friendly environments. It is an opportunity, or this is an opportunity that can be utilized to expand access to quality FP services, including self-care methods. However, again, the community pharmacy channel still experiences some limitations. Some of these has been addressed and others are still pending, including policy gaps, regulatory constraints, fragmented supply chains, and most of the time, the community pharmacies operate independently. And therefore, there is a need to link these pharmacies to sustainable supply chain to support their role in delivering family planning service delivery, including the subcutaneous and intramuscular DMPAC, and also expanding the uptake and delivery of the method they're already offering. Next slide. So to address the challenges I've talked about and also to maximize the opportunity that I've talked about in the pharmacy channel, InSupply have implemented two key projects. The first product that we are calling market test that was or have been implemented between the year 2021 to 2026. The goal of the market test project is to develop and test the viability and scalability of pharmacy business model that offers customer convenient, discrete and quality counseling and training and provision of contraceptive products with a focus on self-injection of DMPAC as part of larger basket of self-care products. The second project that InSupply together with PSK have implemented is optimizing pharmacy channel that started in the year 2023 and it is expected to end in 2027. The goal of this project is to increase access to an expanded and quality family planning method choice for women of reproductive age through a strengthened pharmacy channel in Kenya by 2027. Next slide. Sheila, next. So before we go to what we have achieved, I would like you to take you through the milestone that we have gone through so that we can have FP services in the pharmacy channel. But before I even go to the milestones, I would just like to ventilate on, again, some of the gaps that are currently still existing and that need to be addressed and that the two project has been focusing on. The first gap of challenge is inadequate awareness of community pharmacy practitioners, SP providers. So that means there is a lot of need to do a lot of training and availability of proper channel for dissemination of existing policies, frequent shortages of the products, all related to FP or to family planning. Many community pharmacists and pharmaceutical radiologists lack specialist training in FP counseling and service delivery, and we are all aware of that. And then lack of designated safe spaces to offer these services. The journey has been long because, as you can see, we enacted the FP guidelines in the year 2018. And after that, the following year, in the year 2019, in collaboration with MOH, we developed a training curriculum that will be used to train the pharmacy providers. That was followed with an implemental research to provide some insights on what needs to be done so that we can have these services offered in the channel. And then in the year 2024, again, in very close collaboration with the MOH and Profas, we were able to train 40 trainers or TOTs. That has been very instrumental in training the pharmacy providers. And then after that, we have been able to train and accredit over 500 pharmacy practitioners that are currently providing services across 10 counties that we are currently operating in terms of the two projects. And currently, we are working very hard to digitize the training curriculums, both the in-service and pre-service, and we hope to have more trained in-service and pre-service by the end of 2026. Next slide, Sheila. Okay, so what does an enabling environment look like in the pharmacy channel? For this service to be offered in the pharmacy channel, we needed to have policy frameworks, guidelines, curriculum developed. We need to make sure that the quality of services or service that is to be offered in the pharmacy channel is of high quality. We need to make sure that a critical mass of pharmacy providers are trained, and there is coordination between the pharmacies, the MOH, and the suppliers, so that these services can continue smoothly in the pharmacy channel. Next slide. Currently, as I've said, we are operating in 10 counties, and they are all listed there. That includes Nairobi, Kiambu, Kajiado, Narok, Meru, and Machakos. We also have Kisumu, Kericho, Kisii, Nakuru, and Uasin Gishu. And out of the 526 providers that has been trained and accredited across the 10 counties, 24% are from the PSK pharmacies. And you can see that I think we may need to pull ourselves a bit so that we can maybe push to 40%. Next slide. Yeah,
Thank
from
you,
here, I would like
Kamande.
to introduce Dr. Irene to continue.
Thank you, Kamande, for that presentation. I'd like to welcome Dr. Irene to take over the next session.
Thank you, Sheila. Thank you so much, Daktari, and thank you, James, for the preview. So I think James has alluded to how far in supply is regarding the program. And just to start us off, I am Dr. Irene Olweng. I am a pharmacist by profession. I am currently the Nyanza branch chairperson, that is PSK Nyanza branch chairperson. I also represent all the 16 branches at the National Executive Council, that is NEC. So when I talk about this process, I also talk about it at a personal level because I'm also a PIT. That means I'm one of the trainers in this process for Kisumu County. So my work is easy because I am just going to share a bit of how we went through this whole process. James has started us off. And when you look at my slides, they're quite easy. How did we exactly get all these pharmacies? We have seen we have a total of 126 pharmacies that are PSK accredited. And first of all, there was a call of expression of interest, and that is through PSK. I believe most of us saw the WhatsApp calls that were made from the national office. And this was basically to just ask any community pharmacy owner or employee or staff who is interested to basically enroll for the training. So there was a Google form that was sent out with a very simple registration link. Then, Sheila, I think you have done something. Then after that, that list was compiled. The list was compiled by the national office, that is PSK. And the list was now shared to InSupply, who is the partner. Then after that, of course, several communications were done now between the pharmacies, InSupply, PSK. And I know when you look at the When you look at this slide, down there you can see KPA. And the reason why that is there, because this was for all pharmacies, including KPA. So kindly don't mind that slide. That is because it is one of the associations that had to onboard pharmacies also. But we will focus on PSK because that is who we are. Then after that, trainings were done in different areas. And as you actually saw from James's slides, there are actually 10 counties that this project is being implemented. So trainings were done. And there are two types of trainings. There was the first one, which was in person, and that was a 5-day training in person. And it was quite interesting because you would actually see the dedication, because most of us in the community pharmacy, you actually don't have 5 days to get out of work, close your pharmacy, for you to be able to go for a trade. But you could see the dedication, and people were trained for 5 days. During this time, there was physical engagements in the hospitals. So there were identified hospitals depending on where the trainings were being done. So like when we were in Naivasha, we will have 3 hospitals that will take us in for practicals, so that you're able to learn how to basically put your skills at tests, and learn and practice, and with that you're able to be accredited. So these trainings were done, and manuals were given. So during the training, you'd find a participant has the manual. They must go to the hospital or the area that was identified. You get clients. You literally go through the whole process, from clerking, finding out history, all the way up to the end, to the point where you actually administer or support the lady or the couple with the family planning method. After this, we also had post-training follow-ups. And during this time, the PITs and the TOTs will go around and ensure that people were actually putting the skills to use. After that, then the pharmacies now were given, with that, now the logbooks were put together and sent back to the ministry, because I think, as it was mentioned, this is an MOH guided training. So the Ministry of Health is fully aware of what is going on. So after the trainings, certificates were given and awarded to the participants from the Ministry of Health. So we'd find that pharmacies implementation support using project implementation PITs, that is the project implementation team members. So that was done from within each and every county. So we currently have PITs from each and every county that was listed. So I think I'll move to the next one. So as I mentioned earlier, we have two different, we have the in-person, but then we also, in the process, we realized that there's a lot of interest, and the in-person was becoming very expensive, I think, from the in-supply point of view. So there was a discussion of how do you merge the two? How do you utilize technology to have pharmacy trainings? So this is actually being done by the MOH Virtual Academy platform. For those of you who are aware, you can just go to KHIS, that is DHIS, you'll find the Virtual Academy platform. So there's a training there. It's a 4-week course. And then still with this, you must have a 2-day in-person practicum, which is of course guided by a master trainer. Because remember, for the online course, that your trainer is not there physically to actually assess the skills uptake, and so that is why there is need to have a practicum session that is guided. Then, just like the in-person, logbooks must be filled, completed, and now this time around they're uploaded into the virtual platform. And after that, now accreditation is done, just like in the in-person. and the participants are able to get their certificates, which they can use to confirm that they're actually trained. And it's usually a very easy process. So we can move to the next. So even after getting your certificate, you still continue. So we have PITs who will keep going back to the pharmacies. Sheila, we can move to the next. So we still have PITs who will still go back for post-training support, just to confirm that our targets are met. That means you're able to report, you're able to offer services as is required, and the skills that were actually acquired are in use. So what exactly is in this pharmacy model? I know some people will be wondering. As I mentioned, it is quite an easy thing. We are pharmacists, extremely brilliant people, so this should not be hard. So during the call and after the call, so the PITs and the trainers will go around, the associations, that is PSK, will go around to the pharmacies and just look at basically your pharmacy model and look at, do you actually have a safe space for you to be able to provide the short-term family planning services? And I want to reiterate here that the community pharmacies are only offering short-term family planning methods and not long-term. However, long-term family planning methods, that discussion is still underway to see how can the pharmacies be able to provide implants and other long-term methods. However, that is a discussion that is still underway. So currently, you're talking about the short-term methods. So we will go and identify space together. It is actually a very collaborative process. And part of the things that we will make sure we do is that through InSupply and PSK, there was support during trainings to have what we call the balance counseling cards. And these are usually very important cards. The small cards, it's a whole bunch of cards tied together. So these cards are very essential during counseling. I wish we had the we had slides to show how they look like, but their cards not so big, not slightly bigger than your ATM card, and they help you so that you don't miss out an aspect of counseling. So they're very critical when you're doing counseling, so that you're able to know, how do I handle this client during counseling, and so that we ensure that counseling sessions that are done in Kiambu are the same that are done in Kisumu and are the same that are done in Narok. Basically, just uniformity of practice. Then another thing we're looking at, do you have color-coded bins? Because now remember, if it's short-term methods, then that means, yes, somebody has mentioned the BCS Plus cards. I know some people did not know about it. So we will look at the color-coded bins, because now you know we need to ensure injection safety. And injection safety means that we must be able to, waste management must be done appropriately. And therefore, that meant we had to look out for sharp boxes. There was support actually to issue pharmacies with sharp boxes. Then we had a MEC wheel. This is basically a medical eligibility wheel for contraceptives. So this, it's a small tool. It's like a booklet square. Then it has a wheel inside. So it helps you to be able to see how viable your client is for that particular method. So that helps you when you are, because we are adults, so sometimes during adult learning, there are things you might forget. So at least with the MEC wheel, it encourages you and you're able to offer the best service without having to go back to your books. So it also guides you on what you need to be able to do. So that was the purpose of the MEC wheel, which all the participants were actually given, thanks to InSupply and PSK. Then, of course, we will also make sure we have a demonstration tray. Why a demonstration tray? Because when a client comes to you, and usually we will start from the point of a client has come to you, most times, as we always say, the pharmacy is the first contact place for most of us as Kenyans. Anything that happens to you in terms of health, you want to run to the pharmacy first. So when a client has come to you, most times they'll come and tell you, I want P2, or I had a condom burst, or something like that. So you pick it up from there. You start the entire counseling process. Then you have the demonstration tray that has the various methods that are available in the country. Some of them, we would even encourage pharmacies to have demonstration tools, including even the long-term methods. However, we will tell the clients and we will make it very clear that the pharmacy model is only for short-term methods. But why do we have the long-term methods? Because you need to be able to guide your client so that when they walk out, whether with a method from your pharmacy or if you refer them elsewhere, they walk out with information, correct information on what are the options available out there. So the demonstration trays were put together and we had like a checklist of what needs to be put there. So including the various methods, the pills, we have the DMPA subcutaneous and the DMPA IM. We have and all the other methods that are available, including cycle beads, etc. Then we will also ensure that we have given our pharmacies a TCA card, and the TCA card basically is just to guide the client on when are they supposed to come back for follow-up. And some pharmacies were very creative. Some opted to even go further and absorb technology and be able to have online TCA such that they'll be able to send reminders to their clients and such things. Then we also have, Sheila, I think you stopped sharing. So we also have job aids and posters, and these were also given to the pharmacies so that when the client is in front of you, you're able to just go through your job aid. It will also remind you of what exactly you're talking about. So the job aid will have pictorial information of what it is you're talking about. And finally, we have the pharmacy reporting platform, which is also MOH based, that is KHIS. And here, the pharmacies are highly encouraged to report what it is they are doing. And so that was basically the pharmacy model. And this is what we were looking for in terms of the safe space. Please note that the pharmacists were trained also on how to handle emergencies and how to handle ADRs that will arise from any method that they are providing at the pharmacy point. And that is why even part of the demonstration tray, which I think I forgot to mention, we also had emergency trays, and those are some of the things we look out for, such that when anything happens, a client is able to be served first at the pharmacy before being referred to the next level. So as I conclude, I think I want to look at one pharmacy that we looked at. Yes, Sheila. Sheila, I think you need to move to the last slide. So we have a pharmacy in Nairobi County. It's called Dantrio Pharmacy. And if you look at Dantrio Pharmacy, it's a PSK, we call it a PSK affiliated pharmacy because it's being owned and managed by Dr. Susan Jogu, who has allowed us to use her information for these purposes. And this pharmacy has actually done very well. If you can look at the posters, you actually see that there was well alignment. You can see, I think there was a small space for safe space inside there, where once a client comes to you, you're able to take them to the safe space and have these discussions candidly in the safe space so that you can be able to achieve whatever it is you need to achieve. So basically, we are looking at, from your perspective on the front lines, why are community pharmacies so vital to the future of pharmacy planning access? And what advice would you give to another pharmacy considering joining a program like this? That is what we asked Dr. Susan. And she said that community pharmacies are the first point of contact. I think I have said that. And therefore, it is a vital position to be in, and a lot of good can be achieved with patient safety, counseling, and even follow ups. And actually, she's doing very well with follow ups. She's able to send messages to her clients. So, this is not just about contraceptive aspects, but also other health related issues. I think one of the things I forgot to mention is that when we are going through the trainings, we will be reminded that by the time a client comes to you for contraception, it is no longer just a contraceptive issue. Here, you need to look at many other health related issues, including HIV and all those other chronic conditions. And that is exactly what Dr. Susan alluded to. And she also says that patients can get better advice on what their issues are. And this can also result in them being keen in their chronic conditions from very good interactions with community pharmacies. And therefore, she says that any pharmacy wanting to join the program should not even think twice. This is a very fulfilling program that ensures your patients get their contraceptives of choice, and it creates a connection that makes them feel safe and even reach out to you when they have other health related issue. This is a result of the counseling sessions before contraceptive administration. Remember, I talked about the BCS cards. And so during that counseling session, you'll be able to see what other areas you look at. Then patients feel cared for, listened to, valued, as they perceive that time and attention are being dedicated to their needs. So I think I'll stop there and allow the next speaker to continue, but that was just a session to show you what we have done as PSK and what was the experience for the PITs. Thank you, Sheila. Over to you.
Thank you so much, Dr. Irene, for that enlightening session. I would like to give a chance to James to take us through the next and final session before we do our final remarks. Karibu, James.
Thank you so much, Dr. Sheila, and also Dr. Irene for the session. Let's move to the next slide. Next slide, Sheila. Okay, perfect. So how do we support pharmacies as in supply to be able to offer the services that Dr. Irene have talked about? The first thing that we have done and we continue to do is to support the pharmacy training in terms of our skills to offer the service and also do the counseling for choice. And this we usually do in partnership with the RAMCA or the Department of Reproductive Health and Maternal and Unit Child Health, together with the 40 TOTs that I've talked about. And after the training, we also walk the journey with the pharmacy providers, those who have been trained in terms of practicum, and make sure that they are accredited, make support monthly pharmacy visits so that you can ensure that the skills that has been attained are being put into use. We also facilitate linkage, and this linkage is majorly to facilitate the referral or bidirectional referral from the public sector to the pharmacy, from private clinics to pharmacy, and vice versa. And also, we also link the trained pharmacy with the larger county support supervision so that the quality of service is assured. And lastly, we also support in terms of data generation and insights that are of use by the government, but most importantly, by the pharmacy to make business-related decisions. Next. Next slide. Okay, as we move to the next. Okay, I've talked about the linkage between the trained pharmacies and the public sector. Why is it important? there are many things, or there are many gains to this linkage, but just to touch a few. And first of all, is in terms of managing waste that is generated from the pharmacy, and you are able to link with the waste disposal management system that is either provided by the county or other affiliated agencies that work with the county. Support supervision uh, to ensure that the service that is being offered in this channel of the highest quality, and the provider can continuously get mentorship from the county team and also the profs, continuous training and CMEs, and also the bidirectional referrals that I've talked about, that will obviously not just increase the FP clients, but also the general clients that usually visit the pharmacy. And lastly, and most importantly, is reporting. And I've talked about that. The report that will be generated from the trained pharmacy will be linked to the MOH, but most importantly, we expect to have a window where the pharmacies are able to utilize that data to make their own decisions. Next slide. Next slide, Sheila. I think the network is a bit slow. So, okay. What kind of outcome can we report so far? So far, we can report over 30,000 FP clients have been able to be served through the pharmacy that has been trained. But from the data up there, 30% is from only 23% of the trained pharmacy that are currently reporting. So you can imagine if 100% pharmacies were reporting, what kind of numbers are going through there. And 66% of the 30,000 are new clients. So you can already see that there is a lot of numbers that are layering on as a result of the layered new FP service, and this is expected to grow. Next. Next slide. So there are many learnings that we have collated from the pharmacy channel, but just to mention a few, the first one is we have realized that there is diversified revenue streams that drives growth, and this is from confession from a number of pharmacists that we work with or that have been trained. They are also reporting lasting client relationship, which is usually achieved by meeting essential FP needs with professionalism and care that is exuded by the trained pharmacy providers. The value to growing population segment, especially the middle class, the urban, semi-urban women who seek convenience and privacy or confidentiality when they are seeking services. And lastly, the growth in terms of the self-care basket, and this is a space that is expected to grow in terms of the self-care with the Gen Z generation and even many other clients who want to just to take care of their own health. Next slide. So what are some of the key learnings that we have been able to pick from the pharmacies, and especially the insights on traits of high-performing pharmacy? Most of the high-performing pharmacy are those pharmacies that are operated or the owner is involved in learning of the pharmacy. The pharmacies where providers are exercising initiative and drive. Those pharmacies who are strategically located either near busy markets, bus stations, busy workplaces, and learning institutions. The pharmacies who have been in operation for a long time, obviously, and have earned the community trust, which is most important. And also, there is an emerging trend of pharmacies that are applying digital marketing and awareness campaigns through social media platforms. And they're actually even doing deliveries at home for convenience. The pharmacy providers who are applying client retention strategies or making sure that their clients are happy and always come back. And also, pharmacies always find a way to offer a variety of choices and methods to their clients. So these are minimal a description of a high-performing pharmacy. Next slide. So, in conclusion, we are looking. Our goal is to have increased access for women in terms of accessing family planning through the pharmacy channel and many other channels that offer family planning. And this can only be achieved by making sure that the providers are well trained, they are certified, and they are linked to the government and other agencies who make sure that they have been certified and accredited. Secondly, the pharmacies must be linked to reliable source of products. They must be trained how to create their own demand, and they should be integrated with the larger health system. That is majorly the public sector and other clinics and pharmacies within their surrounding. And also, most importantly, they need to be accredited so that the client, or they can earn the trust of the client in terms of offering quality assured services. Next, which I think Dr. Shira should be taking over from here. Over to you.
Thank you so much, James, and thank you so much, Irene, for the good work that you've been able to do. And thank you for sharing about a few key highlights of the work that we have been able to achieve together as InSupply and together with PSK as an association, and also heavily looking at the pharmacies themselves, because without them, we would not have the structure that we have right now. So just also appreciate those who may be within the webinar, those who may. So mine is just a brief session. So we'll be having another follow-up webinar on the Thursday of 11th. So that's next week. Same time, same place, same platform, just for us to go through the policy enabling environment that has heavily supported the work that we've continued to do with the community pharmacies. And hopefully we shall continue to do, and hopefully they shall continue to implement even when in supply is no longer there, so that then the practice remains the same. And we will also have a panel during the main plenary in the conference. So on the 25th of June, please come to the conference for those who will be coming, and come and engage with us. We'll be having further discussions about the work that we've done. Also get to hear firsthand from the providers who've been implementing the project and who continue to give the services within the community pharmacy space. Also, you will have a space within the PSK booth that is a collaborative approach for us to be able to demonstrate in person how an actual community pharmacy safe space looks like. So you'll be able also to just appreciate how the BCS cards look like. You'll be able to see them. You'll be able to see the mech wheel. You'll be able to see the setup. You'll be able to see and even engage with the same providers who've been implementing, just to learn more about the experience and at least get a first-hand information from them. So we hope to see you there. Please do not miss this opportunity. For those who may be considering to have community pharmacies, for those who already have community pharmacies and are considering, to take up the program, please do so. We'd also like to hear just a few remarks, please, in the chat. Just share one thing that stood out for you from this presentation, so that then we can be able, to just highlight. You can share comments, feedback, even questions, pointers of things you feel should be more improved. For those sharing their emails on the chat, please remember to subscribe to CPD. For those who stayed on throughout the webinar, you'll be able to get your CPD points post the webinar. I can also see we have a few questions in the chat. So maybe in the next 5 minutes or so before I hand over to Manyala, we could be able to tackle a few of the questions. So either Irene or Commander, I'll be able to read out the first question. So a participant is asking if the pharmacist is already fully trained, can they onboard in Kiambu County? Maybe Commander, you could tackle that one.
Hello. Yeah, if the pharmacy provider is trained and accredited, I think he or she can start offering the services.
Okay, thank you. There's another participant who's asking who pays for the family planning services offered by the pharmacists?
Can I go?
Yes.
So the services are paid by the client, because this is a private sector. So we are currently targeting clients who can pay for services. For those who cannot pay for services, are usually directed to the public sector. Thank you.
Thank you, Commander. There's one more question. Many women aged 30 to 45 in our practice attribute their current infertility or delayed contraception to prolonged use of family planning pills started at a younger age. What does current evidence say about the long-term impact of oral contraceptives on future fertility, and how should we counsel such clients? I'd give this to Dr. Irene.
That's all right, Sheila. Thanks, Dr. Namu. I think that's the person who has asked the question. And when you look at oral contraceptives, just like any other medication, they have their own issues. However, when we come to counseling such clients, you'd find that is why I talked about training, number one, because during training, we are taught about, we literally go back and delve into the products, the oral contraceptives and all other products, remembering they have chemicals with them. So we go back and delve into how they affect fertility. Then we have the MECWILs, which helps us to identify what is the best option for such a client. And then we also have the BCS cards. And this one will be able to tell you if a client has been on this particular method for long, and they are attributing it to infertility, what is the next way forward? So usually such clients really, you cannot give a one answer for all the clients because all of them have different needs, have different issues. So yes, I agree. There are concerns about use of family planning from a much younger age, but it does not mean that everyone who starts family planning at a young age will definitely have future infertility or delayed conception due to that. So such clients, they have the way of counseling them. And I think if you're able to go through the training, you'll be able to understand, or we can just talk one-on-one on the side and see how we can deal with that. Thank you.
All right. Thank you. I see more questions have come in. So there's someone who's asking, there's a shortage of oral pills. Is there any solution to that by in supply? Commander?
Okay. From my supply side, I think we, in addition to what we are doing at the Pharmacy channel, we also work very closely with our partners and the government. I know there is a lot of advocacy work from the stakeholders to engage the government to procure more products, but also there are other private stakeholders who are also in that space, and I know that they are also working very hard to make sure that they have increased their stocks. So I think by the month of July, we are likely to get some stocks of pills and DMPA SC, but I hope this will be taken care of very soon. Yeah.
Thank you. There's another person who's asking, client who has high blood pressure and says she used the coil and it once disappeared. Which is the option for her case? Dr. Irene?
That's quite interesting. Usually, I think I want to demystify. I think that's a myth. Allow me demystify. And coils don't disappear. You'd find the coil came out and maybe they did not know, because you'd find some people go to facilities, a coil is inserted, they don't know how that coil looks like, they have not been shown. So when it comes off, they might think it's just something foreign and will discard it. Then they'll say it disappeared. So we really need to look out for when did the coil disappear, quote, quote. And with high blood pressure, we have various methods that are also available. So that should not worry such a client. And that's why I said, you see, when you're looking at your MEC wheel, it actually guides you. Even it tells you a BP of between this and this. This is the best option because, so this is the better option. This is the better option. It really guides you on what you really need to do. So allow me leave it at that. But we really need to go back and find out if it has disappeared. We now need to go back and offer some more counseling, some more give some more information to the client, and then let them able to choose what is appropriate for them. Thank you.
Thank you, Doc. Commander, there's a participant who's requesting if you could explain the process of onboarding if one is already trained.
So the process of onboarding, if you are already trained and accredited, I think you can either connect with us or the Profas member who is who you know, and we can facilitate you to onboard.
Thank you. There's a participant who's asking, you have alluded on coded bins. How do we dispose those? Used needles, do you link to different facilities for disposal? Commander.
Please come again, Sheila.
There's a participant who's asking, we've alluded to pharmacies requiring for them to have color-coded bins. So he's asking how do they dispose them and whether we link them to different facilities for waste management.
Okay, so different counties are handling waste differently. We have counties where the public health system are well structured and they are currently collecting the waste. But in other counties, this is done by private players. So depending on where you are located, if the public health systems are working and you are able to link for the waste management, that'll be okay. But if the public system are not working, then the best thing will be to link up with the private players who can facilitate the medical waste management.
Thank you. There's a participant who says the idea of bringing community pharmacies to the mainstream healthcare system, we should consider assigning them MFL codes so that we can be able to quantify the contribution to healthcare delivery more clearly. It will also enable them to be reporting on the KHIS. Commander, do you want to speak on this?
Yeah. So thank you, Sheila. And as I have said, we are working closely with the ministry to ensure that the reporting system for pharmacy providers and any other provider is simplified and linked to the system. I think as the person who have asked the question have alluded, the platform will be there that is going to facilitate the data that will be generated from the pharmacy channel to be linked with the national data system.
Thank you. There's a question on the chat. I noticed some fluctuations, specifically steep declines, followed by a sudden rise in the total monthly reporting rates. Could you provide some insight or context into what might have driven those shifts? Commander.
Okay, so I think that's very keen of the person who have raised that. So yeah, I think we have had some changes, and especially we are currently transitioning from what we are calling the pilot stage to, of course, and we are prepping for scale, and therefore there are some changes that have been effected, but also the reporting portal during those particular months has been low, and now it's peaking. So majorly it's a result of the technical hitch at the reporting portal. Sheila.
Thank you, Commander. Thank you for all the questions that have been shared, and thank you for the feedback that has been coming in. Again, for those who are sharing their emails, so long as you have joined and stayed through the end of the webinar, you'll be able to get your CPD points. Please also remember to subscribe on the CPD platform on PPB portal so that you can be able to get your CPD points. Please also just keep sharing your feedback on the chat, what stood out for you from the presentation, so that what you also think we could improve on or better, even as we continue to scale up the implementation of the project. Thank you. I think that's all from my end. I would like to hand it over back to Manyala. Asanteni sana.
Yeah, thank you. Thank you so much, Dr. Sheila, Dr. Irene, and James for quite an engaging segment. We, of course, are pleased to continue working closely with the suppliers, PSK, to implement this project. And I'm also, again, just proud as someone who supported the project as PIT for Nairobi, of course, to see Dantry Pharmacy getting the spotlight. It's actually nice that the work reflects on the ground, and there's interest from the membership to support the population in just advancing access. Maybe at this point, I want to take a few minutes to share some announcements and updates that are important for the membership, and then I will invite Dr. Masibo to give a remark to as we close. So for a start, this is a reminder that we have our conference registration ongoing. We are currently doing what you call the last call tickets before the event that begins on the 24th until the 26th. So this period of June 1st until the 23rd still allows you to sign up. The perks of signing before the conference is that you get to relieve yourself of the hassle that is usually there during the event. So for instance, you will have your materials ready, your badges will be there on time, merchandise will be available for you, and then you will not have to spend a lot of time in the queues. And just for convenience purposes, it's just good that you register early, and we invite you to take advantage of this opportunity. I also just want to highlight that the registration process is pretty straightforward and simple. For members, they just need to log in into your membership portal, and then under public events, you'd see the tab for view and register, which if you click, it takes you to a delegate ticket, and you only need to search with your registration number. As part again of the work that we do, or ongoing work that we are currently engaging in, is trying to understand our membership. The Optimizing Pharmacy channel is one of the initiatives and projects that we, of course, share with our membership. But even before that, it's just good and prudent that we understand the sectors of the areas of involvement, interest. So we have this campaign that we've been promoting, and just a Google form, pretty straightforward. You just collect your details so that it helps us map out our members, of course, with the interest, and to see what opportunities align with the area of expertise or work. So we invite you. We'll be resharing this multiple times in the members forum. So when you see this, kindly just fill it, but it's even easier for us when you get other opportunities in future. We can easily place you. Another initiative that has come from, again, the good work that the community pharmacies are doing is the Your Health, My Gift initiative. And we, again, still encourage those interested in the counties of Nairobi, Kiambu, Kajiado, Meru, Mombasa, Kisumu, and Nakuru to express interest. You can send an email to projects@psk.or.ke for more. And we're looking at an initial cohort of 50. So still another opportunity that you can take advantage of. We have this ongoing survey by the National Treasury inviting inputs on national sustainable public procurement market readiness. The deadline for submission is 4th of June. So again, something that you'll see in the members forum being reshared. Kindly spare time to respond to this, as it covers some part of the healthcare sector, including supply chain. And we know we have local manufacturers, distributors, and service providers as part of the membership. So again, this is an opportunity for your voice to be heard. We also are in partnership with the Kenya Institute of Public Health, KIPH, and there's a June intake for their certified courses in project management professional certification, as well as the certified associate in project management certification. If you'd like to just learn more about this, you can reach out to us via communications@psk.or.ke to provide you with further information. And something interesting is cooking. We invite you to stay tuned. We've been in the works around a project that we are excited to be launching soon. So we want you to, again, just be ready when it launches. And this is just a reminder that we are launching soon. And then, of course, we are now active on TikTok. TikTok is not, again, just any other platform. For us, we are looking at it as an opportunity to engage even members of the public in a public-facing advocacy front, healthcare education, public health opportunity. In this case, just to address a few concerns in regards to medication safety, health education generally, as well as harm reduction. And we invite you to follow our page, which is now active. I'm pleased to have seen some bit of growth in the last 1 hour or so as we are pushing the links out. So when you see this, feel free to just follow us and share with your colleagues, and of course engage with our content. Again, a reminder for the small, medium, or whatever entrepreneurs, there's an opportunity for you to get visibility at the conference. Beyond the standard packages for big sponsors in pharmaceutical, in the industry, we have opportunities for you in merchandise, in a delegate access package, where, for example, if you'd like to have an insert, a brochure in the delegates' bags, we have an opportunity for you to do that. We also have other opportunities in the gala dinner that will be a very exciting one with awards. So feel free to engage us via the symposia at psk.or.ke for more. We only have a few days until the conference, and we'd like to ensure that everybody has the opportunity to interact and impact the over 1,000 pharmacists who will be in Mombasa. And then maybe as I share this slide, I want to invite Dr. Masibo to just give a word, and then we wrap it up. Thank you.
Thank you, Manyala, and thank you to the panelists for today, Kamande, Irene, and of course, as I always call her, my best friend Sheila, for the wonderful webinar. But I also wanted to just remind everyone that, the role of OPC in the wider healthcare ecosystem is not just empowering, the pharmacists the way we've been taken through, but there's a wider conversation that is happening, because for a long time we've missed a very huge and important piece in terms of, advancing professional needs to policy and then to practice. And that missing piece has been data. And what the OPC project provides the country is data on what the pharmacists can do. We've been speaking about, UK's pharmacy first agenda and the increasing role prescribing autonomy for the pharmacist. And anytime we go into those offices, one of the most important questions everybody asks is, how do you know this will work? When we talk about primary healthcare opportunities, and Kenya is ripe right now, the policy window is really ripe for us to engage. Whether you're talking about family planning, chronic diseases, where I've seen, especially for HIV and diabetes and hypertension, pharmacists are already doing amazing things. Whether you're talking about MTM, pharmacovigilance, immunization, all these things require that there's a concept that is proven first for the government to start accepting what we're trying to propose. And so I'm very excited about what this project is doing, whatever has happened before and whatever we are going to move forward with. We're going to step up the advocacy role that we've been having, because now we have the data to prove what we've been saying. In the same breath, I think, Sheila, correct me if I'm wrong, I think tomorrow there's a report that has been done alongside what work has gone through. The baseline survey to assess the status of good pharmacy practice in Kenya. I think it's a venture between PPB, URADCA, and InSupply, which I think is being validated tomorrow. And I was reading that report and I was looking at the opportunities that we still have as pharmacists. And the first one was, we have a lot of pharmaceutical work at the lower level being done by non-pharmacy staff. If you go, for example, in the public sector, there's always this question about, especially at the lower levels, people always say the nurses are in short supply. There's always a shortage of nurses. No one talks about pharmaceutical staff. And the reason is very simple, because the nurse is overwhelmed because they're doing work that is not actually their work. And so we are now stepping in and saying, because now we have data, if you employ pharmacists, you don't need an extra nurse, because now the nurse will be just doing nursing work. And we're going to have a lot of advocacy around this because now the data is in. I think the other opportunity is the blood roll boundary between Farmtex and ourselves, which I think has led to a lot of inefficiencies and underutilization of the pharmacists as a cadre. We have a lot of underemployed and unemployed pharmacists. And again, the question has always been, so what are they supposed to do? And the question has always been, where is the data? So I just want to appreciate the OPC project and InSupply for, advancing these conversations and giving us the data and enabling us now to have facts when we are trying to negotiate these things. Thank you so much. Back to you, Manyala, and thank you everybody for attending the webinar.
Yeah, thank you so much, Dr. Masibu. And thank you, Dr. Sheila. Thank you, Dr. Irene. Thank you, James, for honoring us, your presence, and of course, having a very engaging session. We look forward to the next pre-conference webinar and just also physical participation in Mombasa during the conference. Good evening, everyone. Goodbye.
Thank you so much, and goodbye, everyone.
Thank you. Goodbye.
Goodbye and good night.